you're not giving up. You're just you're shifting your hope to something different.
Welcome to Better Together podcast, produced and directed by our Hospice of South Central Indiana, a not-for-profit organization dedicated to making every moment count. We share real stories about hospice, palliative, and personal care, provided in 22 counties all over South Central Indiana. I am your host and president, Steph Cain. Well, today we're having crucial conversations about advanced care planning. If you're new to our podcast, check us out on YouTube, Spotify, or Apple, wherever you digest your content. Subscribe, give us a like. We are better together. I am with Sarah Stevens today. Welcome, Sarah.
Thank you.
Thank you for being our guest. Sarah is manager of our support services here at our hospice, and we're going to discuss the importance of advanced care planning and the role of hospice in honoring end-of-life wishes. So, Sarah, these days we're asking our patients questions. We're asking what matters most to you today, and why is it important to talk about the now and then end-of-life wishes before a crisis happens? Can we address those two things?
Yeah, absolutely. It's something that's very important. So, kind of in crisis moments, we can imagine what a crisis would look like, right? Our emotions are high, exhaustion is real, and we might not be able to think clearly about what we're wanting, right? And so having these conversations early when we're calm, when we're able to kind of clearly define what we want is so important. And it also really allows patients to have this control over what they want their care to look like. What is important to them? Do they want to focus more on quality and comfort? Is it important that they do something for the last time? I want to pass at home. What is important to that patient? So they're really able to have control over the situation. And end of life, we think we have all of this time, but most of the time it sneaks up on us, right?
I had a patient ask when I said, what matters most to you today?
Mm-hmm.
And he said, I just want to go outside.
Yeah.
So we have short-term and long-term. He was thinking, I said today. And so sometimes folks go from building to building to building, right? And they're in our hospice center and they have a patio and they can go outside and hear the birds and feel the wind. And those things matter.
Absolutely.
And in the long-term advanced care planning, what would you like to happen, either in the moments before you pass or after you pass, or what would you like that to look like? So tell us a little bit about these conversations that are so difficult for families to start. Why do you think they're so difficult?
I think it's because patients and families don't want to think about it, right?
Yeah.
They want to keep pushing it down, and if I don't talk about it, it won't happen. But we know that we can't control that completely, right?
Mm-hmm.
And so oftentimes patients too might feel like if I do express this, I'm giving up and I'm not ready to give up, and trying to have that mind shift of, you're not giving up. You're just, you're shifting your hope to something different.
Mm-hmm.
And so, I think it's difficult for patients and families to just kind of start that conversation. Once they do start the conversation though, patients and families both say, I'm really happy that we talked about this. I'm really happy that we broached this topic. So these conversations can be difficult, but are so, so important.
What is the difference between families who approach these conversations with openness versus families that, like you said, we don't want to talk about it. We don't want to bring that up.
Yeah. I think just you see increased peace, right? You see that they have decreased stress. They're not worried about what mom or dad would want. They know what mom and dad would want because they were able to express that to them.
Mm-hmm.
So you just see, you're really able to focus on sharing memories with one another, spending time together instead of having to focus on the really hard conversations. You've already done it. So you feel peace.
Yeah. Can you share a story with us about an advanced care planning experience for the family? All right.
Sure. One of our social workers actually shared this story with me. Her grandmother was on service, and it kind of came very, very, very quickly. And so they really did not have these advanced care conversations. And grandma passed, and they went through her service. And at the end of the service, they realized, oh no, grandma was a devout Catholic and we didn't do a rosary. Like, that was so important to her. How did we miss that, right?
Okay.
So they learned from that experience. And then another family member came on service and they're like, hey, we know what we're going to do right now. We're going to have these conversations. We're going to get everything lined up. So that way, number one, we don't miss anything that would matter most to this person. So they were able to do that. And then when that person passed, they were able to kind of focus on their grief and not having all of these check boxes over their head.
Respecting that faith tradition.
Yeah, absolutely.
What would you say to someone who really doesn't know where to start?
I would say the first step would be to really talk to your healthcare team, really try to understand yourself, kind of what your care will look like, or what your disease is going to look like. First, understanding what that looks like. And then really asking yourself, what do I want my end of life care to look like? Is it important that I pass at home? Do I not want to pass at home? What do I want my care to look like? So once you kind of can think in your head what you would want, I would just encourage to have a conversation with the people that are closest to you, right? That that will help you honor those wishes. It's a difficult conversation to start, but just making sure that you have a calm location, enough time to really just kind of slowly, kindly, and gently discuss those wishes.
Yeah. Now, hospice has a couple of tools like living wills or healthcare proxies. Can you talk to us a little bit about the difference and the piece, maybe those?
Yeah, absolutely. So one part of advanced care planning is actually having those conversations like we've been talking about. The other part is we have these documents that are able to kind of spell out what your wishes are. And so living wills are really just a chance for you to say, I don't want artificial nutrition, or I don't want to be resuscitated, and kind of those specific wishes. And then healthcare proxies allow you to pick your trusted person that they're going to honor my wishes. I want them to speak for me if in the event that I'm not able.
Okay.
So we're really able to kind of fill out a document that kind of legally spells that out so that this person is taking care of you.
Okay. Good stuff. What else? It's been so rich. I think it's been a really great conversation. A lot of information shared. They're difficult, things to think about because, end of life is scary, right? And death can be scary, but it doesn't have to be.
You're really just giving a gift to your family too. We hear oftentimes, I'm so glad that Dad was able to go ahead and pre-plan the funeral. I'm so glad that Mom picked out these important songs to be played at her funeral, because when you're dealing with grief, again, you're not able to think clearly, right? And so when you're at the funeral home trying to pick out songs and music and prayers or whatever is important to you, it can feel very, very overwhelming. So having that gift of already it being planned out, it's just, it's important.
You can just now be right where your feet are.
Exactly.
Yeah.
Exactly.
Well, Sarah, this has been a pleasure.
Thank you so much for having me.
This is Better Together, a podcast dedicated to making every moment count. Thank you for listening. Please like us and share on your social media channels. If you have a question or would like to learn more about a specific topic, you can find us at www.ourhospice.org or call 812-314-8083. Until next time, remember, life is short. We are better together, making every single moment count.